So, good morning everyone. So, I want to tell that there are 5 bad evils in the society which will take a life away. So, with the population aging and the urbanization, these 5 things are diabetes, hypertension, hyperlipidemia, obesity, and smoking. So these 5 things are silent killers of the mankind, and India is going on top with all the 5 problems, and we are seeing the young people coming to us these days with so many diseases because of these problems. So you have to take care of yourself in such a way that you have a very healthy life with good lifestyle modification program. So diabetes is a very serious problem these days, and the young people are also having diabetes. That is what is known as type 2 diabetes mellitus, and one is having this problem without the knowledge because it doesn't have any symptoms. But suddenly you are being investigated and diagnosed for something else, or you go for a routine checkup and you find that you are diabetic. So diabetic harms each and every organ of the body, each and every tissue of the body. It is very bad for the eyes. It causes retinopathy, including blindness. It is very bad for the immune system. It will prone you to various infections, and then it is very bad for the heart, because the heart and the blood vessels are very much affected by the diabetes, and there is a tendency to the early atherosclerosis and narrowing of the vessels. So it is all prone to heart attacks, prone to strokes, paralysis. Then it is very bad. Long term diabetes is very bad for the kidneys, and one goes to the renal dysfunction and chronic renal failure, which will land him in dialysis and ultimately requiring a renal transplantation. And each and every tissue of the body is very well affected by the diabetes, and we have certain limb losses, diabetic foots and gangrenes in the limb, and any wound during surgical procedure or during day-to-day activities will not heal in the presence of diabetes. So diabetes is a very bad disease to have been. So you can control that. You cannot cure the diabetes as such, but you can very well control it. So proper medication and proper consultation with a practitioner who is practicing diabetology should be done, and we should control the diabetes well in normal range. Glycosylated hemoglobin should be between 5 to 6 ideally. That will show you the control of the diabetes over a period of time. So diabetes is a very important risk factor for so many problems coming for the normal living of a human being. Likewise, hypertension, increase in the blood pressure, is having the same effects as the diabetes is having, and there is no organ in the body which is spared by the hypertension. You start from up to down. Brain is affected by hypertensive encephalopathy. Heart is equally prone as diabetes, and rather more prone with the hypertension. The work done by the heart is more in a hypertensive patient, and the blood vessels are having early atherosclerotic changes. A premature narrowing of the vessels is there, and patient can go to heart failure with patients who are chronic hypertension. It affects all the bodies, including kidneys, giving rise to renal failure, then coarctation of the aorta. Then this one aortic problems are there, like if the patient is having a secondary hypertension because of the coarctation, there are ill effects of that. Patient is prone to aneurysms. Hypertensive patients in presence of diabetes mellitus, the chances of having a heart diseases and the vascular complications are much more than in isolation. So hypertension and diabetes are most worst conditions in the life, and these both conditions are the silent killers. You may not have a manifestation of this hypertension immediately when you are diagnosed. It may take some years, and the ill effects are usually seen. So it is always good to control the hypertension with medication and regular visits with the cardiologist or a physician to control it with the drugs. Both hypertension and diabetes are lifelong problems. So fourth in the list is fourth evil is the hyperlipidemia, in which the cholesterol and the other bad lipids like LDL are increased, and there is a deficiency or decrease or normal levels of the good lipids, that is HDL. And likewise triglycerides are also very bad. So people who are having hyperlipidemia, bad cholesterol in the blood, are prone for early disease of the heart and the blood vessels, and in augmentation with hypertension and diabetes, the risk is much more fold. So proper control of the lipids, both with the diet and with the medicines, should be done to have a healthy life. This is a very important risk factor, and it augments in the presence of other risk factors. So fourth in the list is the obesity. A obese man with a sedentary lifestyle, and he is taking a lot of overeating, junk foods, bad habits of taking oily foods, more cheesy food, or food with lot of butter, are prone to have all these problems. The weight should be very well controlled, and regular exercises, lifestyle modification is very important, because obese patients are having much more tendency towards the heart diseases and ill effects of all the diabetes, hypertension, and hyperlipidemia is more seen in the obese patients. So obesity should be controlled to near normal at all the cost with regular exercise and dietary control. So likewise, the fifth evil in this whole problem is smoking. So smoking will augment all these problems. A combination of smoke, hyperlipidemia, diabetes, hypertension and obesity is a killer, and when these all problems are there, a man is much more prone to heart attacks, strokes, and all the ill effects and the longevity of the disease and the lifestyle and all the problems are there with the patient, which he should control all these things with the help of a practitioner, a registered medical practitioner which will control. So in other words, all these five evils should be controlled in a proper way, and proper lifestyle modification is required. Type A personality people are there in the society, so they have to know how to do the relaxation exercise. They should have a yoga training, deep breathing exercises. Then they will cultivate some habits of gardening, playing, traveling, like that. So all these things are all required for a good proper health style, so that the disease, the severity of the disease is minimized and longevity is increased. So these problems are there in this because the urbanization going on, and now these problems are going to touch in the rural area also. So India is top in all the risk factor to prone for heart and vascular diseases. That's the only information to be given by this video.